Alright, so we're back again with Foalin around. This week we're going to be talking about foaling, the main event. So I'm going to be doing something a little bit different this time. We're going to include a lot of video footage, some clips, illustrations, that kind of thing, just to show you exactly what I'm talking about when I get into maybe some of the technical stuff or start talking about the complications that you might encounter. So as that 9-month mark approaches, you want to really start paying attention to your mare's udder. If she's a maiden or you're not sure how she'll react, you might want to start maybe getting used to it being handled. Be really careful first time you try that, and then that way it's not one less thing you'll have to deal with when she foals. If your mare starts bagging up heavily and even getting tight and to the point of waxing before she hits even 10 months, call the vet. This is a sign of placentitis or other serious issues brewing, and it's not something you want to sleep on. So their udders are going to go up and down from here on out, typically with exercise or turnout. So overnight they might be huge, and then when you bring them in, they're going to be smaller. It's going to drive you crazy. Sometimes it's uneven. One side will be bigger than the other. That's normal. But when both sides are big and they stay big, that might mean she's getting closer. Her nipples will also fill out more completely, and sometimes will poke outwards before she starts waxing. The other thing you'll notice is her belly will start to seem dropped or low. Sometimes in some cases, if you look at the mare from the side, they have a V shape instead of just a round belly. And you'll also notice that she'll lose tone in her tail muscles and the muscles around her tail. So everything almost seems sunken down, even though she's in a good weight. That's just everything loosening up and relaxing, just getting ready for that baby to come up. In fact, when she gets really close, you'll be able to lift her tail, and she normally won't be able to move it away from you or clamp it down. That's how loose it gets. Speaking of lifting her tail, now's the time, if your mare has a caslix put in, to get the vet out and get him to remove the caslix. In between that 9 and 10 month mark, you should have your mare settled into her spot wherever you're foaling her out. You should have clean straw ready. The fencing should be safe. And if you're bringing her to a repro facility like this, it's as easy as just trailing her over. So the night your mare is going to foal, you'll probably notice some behavioral changes. She might paw, she might pace, she'll probably dig a hole to china. It's really common. Her appetite may be weird. She might not be eating her grain, but she'll eat her hay, or vice versa. She'll likely get all sweated up, maybe do some rolling, lifting her lip up, and lifting her tail up a little bit, and some of them even start rearing or kicking the walls. And then on the other hand, you might have one that just lays down and decides to foal out of the blue. So she'll probably have some behavioral issues, but this is why we have to watch them. So when she does get down to business, her water will break and a white bubble will follow. And then note the time. You really only have a half hour to intervene or help before it starts becoming risky for the foal and eventually the mare. If you find a red bag or pink or blood colored or anything other than white bag when you lift up her tail, that's a red bag delivery, and that's an emergency. So you need to break through that sac. When she goes down and starts pushing, you need to help her with each push, pull towards her hocks, and that foal needs to get out ASAP. When you see that red bag, that means the placenta is no longer providing the full oxygen. So every single minute counts. So back to regular foaling, because that's not an everyday thing, red bag delivery. If it's been 5 or 10 minutes and you see the white bag, you don't see anything else, you might want to stick a hand in there. Sometimes just the foal's 2 feet are crossed. Often what happens in those cases is the foal just isn't rotated fully, so you're gonna put your hand in there and you're gonna find 2 upside down feet, and then a little bit further you're gonna feel a chin. That's fine. It happens all the time. If the foal's feet are close enough, if you could just get them out just a hair, just so they're sticking out, that'll prevent the foal from pushing through your mare's rectum. If that tears, that's an emergency. For the unrotated foal, you have to get her up, get your mare up, walk a few circles, and what I usually do is whatever the side she was on last when I was manipulating the foal, I'll get her to lay on the opposite side, and then just as she pushes, when she lays back down, you can sort of gently, whichever way as you can feel with your arms, where the shoulders are, where the back is, you can kind of gently rotate them, and they'll kind of go with it. If you're having a hard time maneuvering the foal out or pulling or anything like that, and always pull towards the hocks with the contractions, then maybe time to get her up again and flop her back onto the other side. I find in a lot of cases that is the case if they're stuck. It's just one side will come easier than the other side. And it is actually preferable for one leg to be sort of ahead of the other. This way they're going through the birth canal like this, and they're more narrow, and rather than like two full shoulders coming through the birth canal. In some cases, if you have a maiden mare or a really small mare and it's a nice beefy foal, what happens is those shoulders kind of lodge against the pelvis, and you have to do that anyway. So it's preferable if they're already coming that way. Once the foal's out, they can rest a little bit. Just make sure the amnion's off the face, and you can kind of unwrap him a bit. Just pull it back a little bit, and then you can go get your supplies. You'll need your enema, you'll need your chlorhexidine or hibitane for the umbilical, and whatever cup, shot glass, syringe case, whatever you want, little film cases that you used to use back in the 90s. Whatever you want to use to dip the umbilical, you'll need one of those. You also can get your garbage bag ready for mare's placenta, as well as some string or twine, and a nice soapy bucket of water to wash her udder. And one more thing we do here is we give the mares a shot of Banamine, just a pain reliever, and it's also available in oral tube if you prefer that from your vet. So the umbilical cord will usually just rip on its own, either when the mare gets up or when the baby sort of flops away or crawls away. And at that point, you can give it a dip with your hibitane or chlorhexidine solution. We usually use a 12 ml syringe, little plastic case that it comes in, because we're gonna grab a Banamine shot anyway, so the case comes in handy for the umbilical. I know other people use shot glasses, Dixie cups, like I said, little film canisters, anything, just something clean and easy to use. So right after you dip that little umbilical stump, you can give your foal the enema. It's just a straightforward enema. It's just straightforward as it sounds. You just put it in, squeeze it, and it'll help your foal get on its way. This way we can prevent a lot of colicky kind of foals. It gets them going faster, because the sooner they start pooping, the sooner they'll start nursing. And when your mare gets up, you're going to want to tie up all that placenta and amnion, the whole thing. Just tie it up into a ball kind of under her tail. And I usually use a hay string, so I have lots of length left. I leave that on because as the placenta comes out, it'll go further down again. And sometimes I have to pull it back up and tie it again. So some mares will clean or expel their placenta right away. Some will take an hour or two. If it does take her longer than 3 hours, it's a really good idea to follow up with your vet in the morning. They might want to flush her or just take a look. Just ensure there's no tissue left in there and she's okay to keep going. Anything left in that uterus will cause an inflammation and an infection, which can actually endanger your mare's life. So it's not something to play around with. And speaking of playing around with, just take a quick look at your mare's placenta. Make sure it's all there. Make sure there isn't obvious pieces missing. Check it to see if there's any strange coloring, anything weird about it. Maybe an extra long umbilical cord. There's so many things. But yeah, you can, and then you can bag it up. So now your baby's flopping around, probably doing some pooping and maybe trying to stand up, trying to figure out things, but in the meantime, I'll take the opportunity to clean up the dirty straw, replace it with the clean stuff, give her some new hay and alfalfa, and here I always give them a warm, really wet bran mash, usually with a little bit of alfalfa pellets and beet pulp pellets, and some minerals and lots of oil. So it's just something really soft and wet to go through her system right afterwards, because some of them are a little bit sore, and I find it goes easier for the mare. And once the foal is making an earnest effort to try to stand up, if you want to help him, if you want to steady his butt or just help him as he gets up, keep his balance and give him a rub, that's fine. A lot of times we'll touch their feet, we'll kind of go over them, and as they sort of stand there and try to get their balance. And then you're going to notice their sucking reflex should be kicking in. They'll start sucking on everything, the walls, your legs, everything. So this is why it's really important to try to have as clean of an environment as possible, because everything that's going in their mouth at this point can be absorbed into their gut right now. While the foal is getting its bearings, you can take the bucket of soapy water and wash up the mare's udder. This is really important as it will help you prevent foal diarrhea or scours. And once the udder is cleaned up, I usually take a little bit of milk out of one of the teats and just rub it around on both teats, just so the foal can smell it and it makes it more enticing. And you can encourage your foal to nurse by just putting a little bit of milk on your finger, leading it over there by the head as it's sucking on your finger, and kind of just putting your finger by the teat and kind of getting him sort of in the right neighborhood. Don't get frustrated, don't get mad. It's just going to make your mare upset or anxious. So just sort of keep your good humor and let him or her find their way. So I like to have the foal nursing or close to it within 2 hours. If your foal is having a hard time balancing or nursing in general, or it can't stand up, you can milk out your mare into a baby bottle and get him started that way. If he's able to stand up and you just can't catch on, it's important to keep getting him up to give him that bottle and putting him over by the mare's udder. So eventually, once he catches on, he'll just go over and he'll find it himself. And if you can't get your foal drinking at all, either from the mare or a bottle, you're going to need a vet. They can place a nasogastric tube for him, a feeding tube, and help you figure out what exactly is going wrong. Speaking of going wrong, if your foal is born with contracted tendons or otherwise crooked legs, but is otherwise getting around okay in the stall and nursing and bright and happy, make sure you keep them confined to that small area, and make sure you call in the morning and get your vet out. That way they can do a consultation, and you guys can work out a treatment plan. So if you're at the point where your foal won't drink off the mare, won't drink from a bottle, what you can try right away is called the Madigan squeeze. It's what we use for foals like this, often called dummy foals. Some of them are suffering from oxygen deprivation. Some of them just maybe a really extended or traumatic birth. There's a few things that can go wrong, but the Madigan squeeze is pretty simple. All you need is a nice long piece of rope and the instructions. So once your foal's nursing and sort of trying out some running and bucking, your mare's up, showing interest in food and bright and alert, you can give her some more hay, alfalfa, a mash if you're going to do that, and you can go back to sleep. So the next day you can deworm your mare with ivermectin. Take your foal's temperature. I usually do it twice a day at this stage. Dip that umbilical again. Just give it a really quick look, maybe one more dip. Just to make sure it's healing and it's dry. That's going to be a direct window right into your foal, so you don't want any bacteria or wet straw or crap, anything getting in there. You should also contact your vet to do an IgG test. That's really important. It's the only way to know that your foal is getting enough antibodies from the mare's colostrum. Some mares just don't have the quality of colostrum necessary. Some foals just don't absorb through the gut. Whatever goes wrong, if they fail to absorb those antibodies, what has to happen is the vet will give a plasma transfusion, so that way your foal has enough antibodies to grow up healthy. So a healthy, strong foal can be let out the very first day. Weather permitting, of course. There's little foal blankets that you can buy just to keep them safe from the elements if it's rainy or if it's snowy, if it's winter. Even just a short break is great for their legs. It's great for mom to get out and get moving, and just a little bit of sunshine just seems to really do them good. And when they come back in, it's important to check that umbilical stump again and maybe just take the foal's temperature really quick. just to make sure he's thriving properly and there's nothing going on. After a few days of daily turnout, you may want to turn out with other mares and foals. That's perfectly great as long as you have enough space so that the foal and the mare aren't cornered. They've got lots of room to move around. But if you have a bully or a baby stealer, you're probably going to want to wait till that foal is a little bit older so that way it can get away on its own and not get caught up and hurt in the process. So that's it. Now your foal's on the ground. Now you can get a little sleep, make some plans for maybe next year's foal, and keep taking that foal's temperature. It's going to be one of the first signs of anything happening with it. So a lot of times if you're waiting till your foal does show signs of sickness, it won't be too late, but it's going to be a much more serious illness. So a high temperature is going to be one of the first signs that you can watch for in terms of sickness or trouble with the foal. So thanks for joining me today. I encourage comments or questions in the comment section. So next week, I hope you join me. We're going to be talking about raising that foal, things to look out for, things that foal needs, health-wise, behavior-wise, things that can go wrong, of course, and everything your broodmare might need while she's nursing that foal. Everything leading right up into weaning, so don't miss it. Thank you for joining me today. Happy foaling.